as a lawyer for the last 29 years, actually been involved in a lot of cases involving Health Canada trying to take natural health products away. And, for my whole career, they've been trying to do it. And the mechanism that they want to do it is they want to treat them like chemical drugs. Our Food and Drug Act and regulations are designed where the legal premise, the starting point for all of this, is that everything is illegal. So you can't use anything, be it a chemical, be it a plant, for a therapeutic purpose in Canada. Like, just to give you an example of how broad it is, literally, you can't in Canada legally use water. You can't give it away to people. That's selling under our act. There doesn't have to be an exchange of money. You can't do that in Canada unless you have Health Canada's approval. So everything is illegal. And the only exceptions are Health Canada will grant you an exception to allow you to sell in the form of a license. Like, we know from experience that chemical pharmaceutical drugs are, as a class, extremely dangerous. In fact, the three of the main leading causes of death in all Western countries are connected to pharmaceutical drugs, including, taken as directed. It's just absurd. And so then let's talk about how safe natural health products are. And I'll let your viewers know that if they want to, kind of dive deep in this and learn exactly what's going on, there's a nonprofit called the Natural Health Product Protection Association, and their website is www.nhppa.org. And on that site, there's a 35-page discussion paper that is really the meat and potatoes. What's your risk from dying of a natural health product compared to other risks that you face? Because whenever the government tells you, you need to be protected from something because it's so scary and dangerous, it's important to compare it with other risks so you can go, oh, okay, well, I kind of understand the risk of driving a car. Is this more or less dangerous? Am I really concerned, right? And it's actually recent that we would have what we call a regulated industry. And none of us felt unsafe before. But if we needed strict regulations to protect us, then 2004 should have been the Wild West. That should have been when you had to step over dead bodies to get to your health food store because, oh my gosh, there's no regulation at all. Well, Tony, do you know that in 2004, you were 14 times more likely to be killed by lightning than to be killed by a natural health product? Our risk of being harmed, let alone killed by lightning, are so minuscule that we wouldn't give up a single freedom, even a minor freedom, to be protected from it. So, and yet 14 times is a dramatic, increase. Like, it's not even fair to compare the risk. And that's because these are, the ingredients are primarily ingredients that are in our food supply anyway, right? So if we're eating the stuff, who cares that we put it in a capsule or a tincture, in higher concentrations, because it has a therapeutic purpose then. In the risk analysis world, ultra safe. So Health Canada is for sure going to approve this because you've hit the ultra safe level. Ultra safe is 1 death per million per year caused by a product. So let's use acetaminophen, for example, brand name Tylenol. Every one of your viewers has acetaminophen in their homes. And taken as directive, acetaminophen is ultra safe. So it's only expected to kill 1 Canadian per million per year. So we would expect to have, taken as directed, 40 deaths, because there's 40 million of us, a year by acetaminophen taken as directed. Now, we have way more than that from acetaminophen because people take it not as directed, and it can be very dangerous, actually. But it would mean that single over-the-counter painkiller, acetaminophen, is statistically so much more dangerous than the entire natural health product industry. In 1 year, acetaminophen causes more deaths than likely have ever been caused by natural health products in our history. These products, they're tremendously effective. I can give you story after story after story of people that are only alive because of natural health products. We should have the right to choose to access a natural health practitioner as part of our medical services plan. Well, we're going to lose our natural health practitioners with these changes. But they're basically saying, look, we're imposing this on you. It's non-negotiable. That's the exact word they used. It's non-negotiable because it comes from a committee of senior management who we learned were just four bureaucrats, none with expertise in the regulation of natural health products, but a couple with clear ties to international trade. So you know where this came from. They're going to bring in cost recovery. So they're going to impose the fees that they pay, that they charge the chemical drug companies. So, if you manufacture, you have to get it. It's a site licensing fee every year. If you're going to apply for a product license, you have to pay a fee each year. If you've already gotten approval, you have to pay a fee each year just for the right to sell. And these fees are actually quite large, Tony. So these fees alone will drive a number of natural health product manufacturers out of business and will drive up prices for everyone. Now, they're also increasing the regulatory burden because they're moving us to harmonize natural products with chemical drugs. They're using the fees that they charge to go after, they're creating a new enforcement arm to make sure that these new regulations are complied with and to go into the marketplace to censor truthful health information. But Health Canada is taking the position that, look, at when we grant you a license, we approve a label claim. So I'll use a product as an example that's called Empower Plus, and it's a vitamin and mineral supplement that was created originally to treat very serious bipolar disorder. And it's, in my opinion, likely the best treatment for that in the world, even though it's just vitamins and minerals. Now, their approved label claim is something like supports mental health and well-being. Well, that doesn't tell you that, if you're managed on this product properly by somebody who knows, what levels to take and how to manage you, that it could treat serious mental health conditions like bipolar disorder and rocks with things like anxiety and that. And in fact, Tony, there are 35 published peer-reviewed research articles on that product. The company didn't do any one of them. They were all paid for by governments around the world. So let that sink in. So this product has shown such efficacy for serious mental health conditions that governments have funded research into it, leading to 35 journal publications and in some blue chip journals like Journal of Psychiatry, Journal of Child and Adolescent Psychopharmacology. Like, these are the mental health journals out there in the medical community. And Health Canada takes the position that truthful information cannot be shared with the Canadian public. They want to be able to enforce this censorship, and then they also want to have the power to make sure that people don't create underground pipelines and access to products. And so those penalties increased as of June 22nd from $5,000 per offense as a maximum fine to $5 million per day that you're in violation. And if you're a company, every officer, director, employee involved in the violation, who even acquiesces, whatever that means in this context, as we go into full harmonization, we're going to lose the right to use traditional use evidence to support claim. We're launching campaigns. We already have one on our site to basically create pressure on your MP by visiting them, by phoning them, by writing letters, and not just your MP, but the Minister of Health. In the past, we've managed to stop this stuff. So, that in the late 90s, they were doing this, actually, ironically, bringing in cost recovery, which we're facing again today. And citizens rebelled and the government backed down. In 2008, they were trying to bring in these fees that they've now just imposed on us, and the citizens got mad and the government backed down. This is an issue, Tony, that people do get excited about because they rely on the products. Yeah, right now, natural health products, there's no limit on the types of conditions for which you can get approval. But once we go into this self-care framework, we're not going to be granting licenses for any condition for which you would seek the advice of a healthcare practitioner licensed by province. But you have to get involved. That's you. If you sit on the couch now, you're actually fighting for the other side. You're fighting for slavery.